Well, I am very excited to make this announcement. Very recently, our parent surgical society, the American Society of Plastic Surgeons, or ASPS, which is the largest plastic surgical society in the world, came out with a formal position statement on the surgical intervention for chronic headaches. In this critical document, the ASPS formalizes their opinion that when conventional therapies such as medications, acupuncture, massage, or various injections have failed, that surgical intervention should be considered the standard of care in the treatment of these chronic headache patients. This is a very important announcement, and practically what it means is that given a comprehensive review of the surgical literature citing over 80 publications that are peer-reviewed and have been published in the scientific literature, a formal surgical society is of the opinion that these operations are safe, effective, and hopefully these announcements will raise awareness in the minds of both patients, their treating physicians, as well as insurance companies that these operations should be considered standard of care for these patients.